Welcome to the Health Daily Show. I'm your host, Chitra Nabat. Joining us today is Dr. Rasu Shrestha, Chief Innovation and Commercialization Officer, Advocate Health. Rasu, welcome. Thank you for joining us.
Absolute pleasure to be here, Chitra. Thanks for having me.
Rasu, Advocate Health is the fifth largest nonprofit health system at $28 billion in revenue after the recent merger between Advocate Aurora and Atrium Health. Share with us the scope, scale, complexity of the new organization.
Well, thank you, Chitra. It's really interesting. We've really come together as now one of the leading health systems in the country with significant complementary capabilities from the Southeast and the Midwest geographies, with the scale needed to forge what I believe will be a new path forward for healthcare in America, making each of our communities better and healthier. Yes, the numbers do speak for themselves. $28 billion in annual revenue, nearly $5 billion in community benefits. Overnight, grew from 75,000 teammates at Atrium Health and 75 at Advocate Aurora to now a combined 150,000 teammates across Advocate Health. And it's really interesting. It's less the numbers, it's more about the impact. And our goal is doing more, better, and faster. And I'm really excited about all of the possibilities on the road ahead.
Impact. When two large entities come together, there's an expectation that there's going to be a lot of impact, right? And big promises of synergies to achieve revenue growth, cost takeout, efficiencies, greater patient access and affordability, scale to achieve population health and health equity. What are the top three synergies in focus?
It's a great question. What we've decided to do as a combined entity is really leaning into three accelerators. Data and analytics, really important. Number two, digital consumer infrastructure. And then number three, research and population health. And in doing so, we're delivering value across 6 areas. And we've actually publicly pledged 6 specific areas of impact. One's around advancing health equity. Number 2 is really around improving affordability. And then in this day and age, the critical need to build a next generation workforce. So that's our third area of pledge. And then the fourth is really elevating clinical preeminence and safety. And then accelerating learning and discovery as one of now the largest academic health systems in the country. And then last but not least, leading environmental sustainability. So 6 specific pledges tied to 3 specific key accelerators.
Bring this to life for us. A year from now, what are some of the target results that we can expect?
Well, it is about the impact, right? So just as an example around advancing health equity, and you know how important this is to me personally and to us as a combined health system and Advocate Health. What we've committed to is we will invest $2 billion over the next 5 years to disrupt the root causes of health inequities, really creating healthier rural and urban underserved communities across the geographies that we're a part of. And that onto itself, I think, is tremendous. But even around affordability, what we're doing is we're committing that uninsured patients who are at or below 300% of the FPL, right, the federal poverty level, will have access to charity care across communities that we serve, making care more affordable, accessible to our most vulnerable patients. But not just that, right? On the workforce piece, creating more than 20,000 new jobs over the next 10 years in our communities with a variety of different things that we're doing across our combined health systems. So just a couple of snippets of key pledges that we're making with specific goals that we have around the targeted areas.
With this scale and complexity, there's inevitably there are barriers. What are some of the significant barriers to achieving these synergies?
Well, healthcare continues to change at a very rapid pace, right? With the pandemic, identifying opportunities in our care delivery system as a whole. And there are a lot of factors shaping our path forward: the evolving digital world, the workforce pressures, the cost challenges, the health inequities, all underscoring the need to really meaningfully transform the system of health that is Advocate Health. And one of the things that I continue to focus in on is how do we make sure that we're driven by our mission, right? Our mission is to improve health, elevate hope, and advance healing for all, with a vision to really be the national leader in health, learning, and community. This is our moment in time. So how do we continue to, like I said, be driven by our mission? But at the same time, driven by our approach, and then driven by our partnerships. So the approach is really proactive versus reactive. It's person-centric versus just patient-centric, and driven by our partnerships. I truly believe that the future of healthcare will be built on the shoulders of the strongest of partnerships. We just broke ground here in Charlotte for the Pearl, our innovation district, the world's first innovation district on this side of the pandemic, and also home to the new 4-year Charlotte campus of the Wake Forest School of Medicine. And then we're creating jobs. We're really at the verge of economic resurgence across the Southeast and the Midwest. And so really excited about the specifics of how we're driven by our mission, our approach, and our partnerships.
How do you risk mitigate against any of the barriers to achieving these synergies, whether it's the cost, the efficiency, the revenue growth, the population health? How do you risk mitigate?
Yeah, the bottom line here is it is high time for us across the healthcare industry to elevate ourselves from silos to system, right? And that's the war cry here. How do we make sure that we move from silos to system? And one of the specific approaches that we're taking as we look at innovation and commercialization and opportunities across Advocate Health is to make sure that we're aligned to sufficiently capture the value of this combined health system, and make sure that as we're innovating, we're actually structuring to cross this, what we call the O gap, right? Many organizations, innovations really fail to create their promised impact because they cannot effectively transfer into operations, and they fail to cross this O gap. So really making sure that we're structured with the aligned processes, the aligned approaches, as well as the aligned capabilities to ensure that Advocate Health is able to truly take advantage of the expertise that we have, as well as the scale that we have to then impact the changes that we need to be impacting on the road ahead.
Now, you've got two big environmental buckets, if you will, that you're dealing with, right? So one is bringing together these two organizations, right? Combining and integrating people, process, systems. On the other hand, you've got the healthcare industry going through significant continuous headwinds, whether it's cost, recession, inflation, depressed to negative margins. So how do you balance running the business versus investing in innovation and changing the business?
Yeah, so it is about that balance, but it is also about making sure that we're able to truly take advantage of the specifics of who we are uniquely as a health system. There's for example, a lot of trust that we've built across the patients and the communities that we're in service of. There are specific elements of how we've defined our path towards value. There are specific tools and talent that we can take advantage of, as well as the experience and the elements of how we might be able to bring forward the components of access across the communities that we're a part of. So it is a very aligned approach in taking advantage of who we are, but uniquely bringing together the right types of partnerships to further our mission in service of the communities that we're a part of.
When it comes to then innovation, partnerships, some examples where you're innovating at scale and the outcomes, where it's actually noticeable to whether it's the patient or the doctors, nurses, clinicians?
Yeah, so I talked earlier about moving from silos to system and crossing the O gap. One specific example and a big area of opportunity that I'm truly excited about is in the space of senior care, right? As we look at senior care, it's a $740 billion market that's expected to double by 2030. And 1 in 5 Americans will be over 65 by 2030. And we believe that at Advocate Health, we have a tremendous opportunity to meet our patients and our consumers where they choose to meet us and impact the senior care market in a significant way. We're focusing in on a variety of different things, everything from living well and aging well to brain health to home-based clinical ecosystems, to making sure that we're able to augment the senior care clinics with primary care, independent living support, and then the specifics of some tremendous research and academic work that's coming out of our dementia and Alzheimer's care. And you marry that with complex chronic care, you've got the plethora of an end-to-end senior care, aging well strategy. And so really excited about that specific area.
Rasu, let's talk a little bit about competitiveness. Publicly traded health systems have to answer to Wall Street and shareholders on performance targets and their stock price. Your role is innovation and commercialization in a nonprofit health system. Where are the incentives to be competitive and commercial? And what's the accountability mechanism?
No, it's a great question. And as we've grown as a health system from a high-performing local hospital system in the yesteryears to in the last couple of years, a growing health system in the region across the Southeast and also in the Midwest as Advocate Aurora. Today, we're one combined Advocate health system. And our goal really is to be this transformative health company and how we lead the industry as a transformative health company. And, we're very focused target outcomes and results, right? Competitive positioning in the markets that we serve, growth and financial performance to invest in communities and new systems of health. We want to be a center of gravity to attract talent and partners and capital. And we want to lead as a national change agent to improve our industry overall with the ultimate focus on fulfilling our community mission. So very targeted outcomes and results, but also with a very aligned approach across the combined health system.
Rasu, leadership. In career business, there are many rules, codes, norms to how things are done. Where have you been a code breaker and how did you do it?
I love this question. So I'm a big carpe diem guy, right? Live life to the fullest. Ever since I remember, I've always wanted to be a doctor. I pursued this passion, became a physician, continued to build on that passion to make a difference in the lives of our patients and our communities. And there's this, you're familiar with this probably, ikigai concept, right? And when you talk about ikigai, it really is about finding that right balance between passion and mission and profession and vocation. And for me, when I think about breaking the code, it's the combination of all of those elements that define who it is that I am and what it is that I've been doing for the last 25, 30 years. So really excited about that. And for me, to be quite honest, it's been a motto of never settling for good enough when great is just around the corner. I went from radiology to embrace informatics and innovation and strategy and transformation before it was the thing to do, right? Over two and a half decades, almost 3 decades ago. And I'm always about connecting the dots and seeing the bigger picture. And I'm always about elevating yourself to see the greater good that we can do, right? From silos to system. And at the end of the day, Chitra, it really is about the growth mindset versus the fixed mindset, right? How do we make sure that we're able to tackle our challenges head on and use those challenges to help us collectively grow? And that's what this is all about.
Rasu, thank you so much for joining us.
Thank you, Chitra.